The next thing we're going to look at are the patient's neural dynamics. As we know through certain studies is that sometimes a patient's complain, whether it be lumbar, hip, knee, ankle, that there may be something that's affecting the whole neural dynamics. And so we have certain tests that we can look at. And the 4 tests we're going to look at are slump, straight leg raise, passive neck flexion, and prone knee bend. So as with everything that we've done so far, you want to establish the patient's resting symptoms. And when you're assessing and reassessing the patient's neural dynamics, you want to make sure that you are consistent every time in the patient's position. Because the patient's position, if it varies a little bit, is going to alter the test and alter the signs and symptoms. Any symptoms? Nope. Okay. So I'm going to have the patient have her hands behind her back. I'm going to make sure that her lumbar spine stays relatively straight. Where I want more of the flexion to occur is more in her thoracic spine. So when she bends, not so that she doesn't move her neck, what I'm going to ask her to do is I want you to look straight ahead towards the camera. Okay? Doing okay? Now let me have you kind of slump forward as far as you can. Okay? And so that's all she has. Any change in your symptoms? Now I'm going to put a little bit of overpressure, making sure that I'm going to have my hand here to make sure that as I add each component of the test, that she doesn't straighten up or change, or I can feel that if she's trying to avoid that position that she may change. So I'm just going to have, I'm not putting a lot of pressure, just a little bit of pressure. You doing okay? Mm-hmm. I'm going to have to ask her to bring her chin down to her chest. Any increase or change in her symptoms? Okay. I'm just going to hold her head here. You doing okay? Mm-hmm. I'm going to ask you to, I'd usually test the uninvolved and then the involved side. Go ahead and raise your leg up. Any increase or decrease in symptoms? No. If there was no increase, I may add ankle dorsiflexion. Let's say that provoked her pain. Then I'm going to ask her to lift her head up and see if there was a change for the better or for the worse. And once again, and then I'd let go with each component. And once again, I would test the other side. So I'm looking for 3 things when I'm doing each of these tests. I'm looking for the reproduction of their symptoms. I'm looking for, is there a difference in range compared to if she could extend this leg further than this leg. And also, I'm looking for, does a distal component, a move in the distal component, affect her pain? So if we did this test again, and let's say she was in this position, she slumped her, she bent her head, and she said, "Ow, that really increases my buttock pain." I'll have her lift her head up and see if it changes. And the only thing that I am changing with that is really the nervous system. I'm not changing her back position. So that may tell me that part of her pain may be something to do with adverse neural dynamics. So that is the slump. Let me have you lie down for me. Now, I'm not going to use a pillow. If I did, that may change her symptoms, as if I use a pillow, that's going to put her in a bit of neck flexion. So for my sake, to be consistent each time, I usually do it without the pillow. But if I did test it with the pillow, then I should retest it every time with the pillow. So once again, establishing resting symptoms, I'll test her uninvolved side. With this test, you want to ensure, the difficulty with this test is really maintaining knee extension. A lot of times what may happen is someone will bring their leg up, and if they don't have a good hold on knee extension, the person's going to bend their knee and you're going to take them further, and that changes the whole test immediately. So I'm going to make sure I hold her into knee extension, any symptoms, and then I'm going to take her up and just feeling. So I'm feeling here when I feel R1 or the quality or the resistance, and she's a little tight there. So I'm just going to stop right there and see if that changes her symptoms. So let's say she had buttock pain. Let's say this increased her symptoms. So to take a distal component and see if that makes it worse, what I can do is put her ankle on my shoulder and do a little ankle dorsiflexion and see if that increases her symptoms, and that will tell me, okay, something may be going on with her neural dynamics, or what I can do is hold her in that position and ask her to bring her chin up towards her chest and see if that increases her, or decreases for that matter, her pain there. And then I know something is going on with her neural dynamics. So that is a straight leg raise. Next one is passive neck flexion. Here we can use this for neck pain, thoracic pain, lumbar pain. And here I'm taking her, going to hold her occiput, establish any resting symptoms, and then take her into passive neck flexion and seeing if there's any increase or decrease or change in her symptoms. It's passive neck flexion. Next test will be prone knee bend. With this type of test, so let me have you on your stomach, I would look at if someone came in with anterior thigh pain or maybe some numbness and tingling in the anterior aspect of their thigh. And with this test, establishing resting symptoms, then I'm going to take her into prone knee bend and determining if there is any increase in symptoms. Now with this test, it's hard to determine, can I use a distal component to see to see if there's any increase or change in symptoms. So one other modification, let me have you in sideline for me. Actually going that way, is what we can do is to really test out the anterior aspect, the femoral nerve, is I'm going to have her flex forward, determining any change in symptoms. Then let me have you flex forward here and keeping your head up here. So she's just going to flex with her trunk. Is there any increase in symptoms? If not, bring her knee to her chest. Any increase in symptoms? If not, then I'm going to have her hold her bottom thigh here. And I'm going to take her into hip extension, making sure I hold on and keep the angle of her knee flexion so she doesn't straighten out, and kind of feeling quality and resistance and determining if she has any symptoms. So let's say she had symptoms there. Then to add a distal component, let me have you look up and seeing if that changes the neural dynamics. So this can be another component to test, a variation of the prone knee bend test to test structures more anteriorly.